I see that you made an appointment today for a foot, knee and leg examination. So what's going on? What happened?
Yeah, so the bones in both of my legs have been hurting recently, and my left knee feels like someone's touching it when no one's actually touching it.
Okay. Left knee, phantom sensations occur. And when does this happen? All the time? Sometimes when you're doing a certain activity?
It's honestly random. I don't think it's attached to any specific activity.
Okay. And are just your knees impacted? How about your legs and your feet?
I really just feel it on my knee.
Okay. And when did this begin?
A couple weeks ago.
Have you taken up any new activity, any lifestyle changes?
I have started running a little bit more.
And do you use proper running shoes?
Yes.
Good. Any other symptoms I should be aware of?
I think that's it.
Okay. So no other symptoms. Do you have any pain associated with these sensations?
Well, the bones that are hurting, but that's not really connected to my knee, so.
So the bones are hurting too?
Yeah.
Okay. When did that pain begin in your bones?
I think a week before my knee.
A week before the knee. Okay. On a scale of 1 to 10, how intense is the pain?
About a 6.
6 out of 10. Okay. Do you have any headaches? Any hearing abnormalities, tinnitus, any blurred vision or double vision?
No.
Okay, so eyes, ears, not impacted. Okay. And that phantom sensation of somebody touching you, is it all around? Is it mostly localized in one place? Where is it happening?
It's more in the bottom part of my knee, but it is over the whole thing.
More on the bottom. Okay. Interesting. Are you on any new medication?
No.
No new medication. Okay. And how often would you say you're running?
A couple times a week.
Do you have any difficulty breathing while you're running?
No.
Okay, interesting. Okay. So let's go ahead and just visually inspect your knee. If you can kind of cross your legs a little bit and bring this one up. Gonna go ahead and put on some gloves and we'll do a physical assessment first, and then I'm going to do a neurological assessment, and then I'll focus on the legs and your feet. Do you feel that sensation right now?
It's very slight.
So let me go ahead and just visually inspect your knee first. Skin appears normal. There are no blues or grays, no redness. I'm gonna go ahead and palpate for any inflammation of the knee tendons, and the patella in the front. I'm not able to feel any indentations around your kneecap. I'm gonna go ahead and tap on the patella. Let me know if you feel any pain. And I'm going to go ahead and check your sensitivity to cold first. You feel this?
Yes.
Good. And this?
Yes.
And this?
Yes.
And sensitivity to vibration. Feel this?
Yes.
And this?
Yes. Yes.
Good. I'm gonna take a couple of measurements. 7, 16, 17, 2, 2.5. So good ratios. I'm going to check the symmetry. Seeing a little bit of an asymmetry here. There's a slight shift towards the right side in your tendon here. Let's do a sensation test. Keep your eyes closed and tell me if you feel sharp or dull.
Dull.
Good.
Sharp. Sharp.
Good.
Dull. 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 Sharp. Sharp. Sharp.
Good. Okay. Good. You can now put on your feet here. Okay. I'm going to take a couple of notes. Dermatome examination was negative, no positive findings. So skin sensations were good. I just noted a slight leftward orientation of your patella and kneecap, which is a little bit misaligned. I'm gonna make a note of that. We'll keep an eye on it. Alright, next up I'm going to go ahead and check the dermatomes in the rest of your body on your chest, your arms, and your upper part of the legs right here, and your face, and do a more in-depth neurological examination to see if there's anything going on with the nerves, the cranial nerves. Have you noticed any of those sensations anywhere else on the body?
No.
No. Okay, so go ahead and keep your eyes closed. going to touch again with a sharp or dull object. Just say sharp or dull.
Sharp. Okay. Sharp.
Good.
Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull.
Wonderful. So upper body dermatomes, no positive findings. I'm going to focus on your face as well.
Sharp. Dull. Dull. Sharp. Dull.
Good.
Sharp. Dull. 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 Sharp. Dull. Sharp.
Good. Okay, next up I'm going to tap on the bony prominences of your upper body, and I'm checking for any sharp shooting pain, any abnormal neurological responses. Okay, I'm gonna start with the top of your head. Wonderful. And let's check your reflexes. You can just leave this arm loose. Okay, 1, 2, 3. Okay, 1, 2. Good. And the other one. Good. Okay. So I'm not able to find anything abnormal with the dermatomes on the upper side of your body. Okay. I'm going to quickly check the temperature of your upper body as well. Seeing some changes in temperature throughout the body and very obvious gradients of temperature can be a sign of neurological disorders. So I'm not able to note any changes in temperature gradient throughout your body, which is a very good positive finding. Okay, can you give me a big wide smile? Okay, good, and no frown. Good. Can you lower your eyebrows like that? Good, and raise them up. Perfect. So good mobility, the cranial nerves controlling the movements of your face. I'm going to attempt to push you back. Don't let me do that. Resist. Good. Now I'm going to attempt to bring you forward. Perfect. And I'm going to attempt to rotate your body. Good. Perfect. Okay, so I think I'm satisfied with the upper body examination. Not able to note any positive findings or anything abnormal with the cranial nerves. Okay. Let's go ahead and lay down, face up first, so I can take a closer look at your knee, legs, and feet. Checking for any skin indentations, any hidden lumps. And for signs of edema. Checking the superficial skin response. Okay, no neurological damage is noted. Can you flex your right foot all the way to your chest? Any pain there? Oh, good. And the left one as well. Legs, any pain there?
No.
Okay, good. Alright. I'm gonna go ahead and take a couple of measurements. Of the skin here. Checking the level of fat tissue as well as the skin response. Okay, it's normal. Good. 12. And here was 12. Good. Is it okay if I remove your socks?
Yeah.
going to check the skin first after the reactive substance was placed. Checking in between the toes. Good. Capillary refills. I'm seeing a slight delay in capillary refills. It's almost 3.5 to 4 seconds, which explains why your feet are also so cold. Lower body circulation is not optimal. Very cold feet and getting warmer towards the knees. I'm gonna check the pedal pulse. Okay, 2 plus. Good. Okay, I'm going to check the integrity of the phalanges bones. Good. And the metatarsal. Excellent. And can you wiggle your toes in this position? Okay. Can you attempt to bring your big toes towards your head? Good. And you can lower now. Okay. Can you push into my palms? Good. And I'm going to attempt to spread your legs apart. Don't let me do that. Resist. Good. Alright. Okay. Let's check toe symmetry. 20. Good. Okay, take a couple of measurements. 4, 5. Across the ankles. 8. 8. 6. 8. Good ratios. Okay, I'm going to check the dermatomes on the upper side of your feet. And I'm going to touch with something that applies pressure to say yes when you feel it.
Yes. 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 Yes.
Okay, and now I want you to say now when you stop feeling this sensation.
No.
Good. Okay, do you feel this?
Yeah.
And this?
Yes. Yes.
Good.
Yes.
Okay. Now I want you to say now when you stop feeling it.
No. 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 No.
Good. Is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Dull.
Okay. Okay, you can turn face down now so I can take a look at the plantar region of your feet as well as your calf muscles in the back. Okay, I'm gonna go ahead and check for edema first in your calf muscles. And palpate the plantar region. I'm seeing a symmetric buildup of callus. Is this painful at all?
No.
Plantar region is not painful. I'll go ahead and take a couple of measurements and check for symmetry and any inflammation. 21, 20, 5, 5.5, 8, 7, 9, 8, 7. Checking for any indentations on the skin. Do you feel that?
Yes. 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 Yes.
Good. Okay, let's check the symmetry of the calcaneus region. 42, 41, 45, 45. Good symmetry. Okay, is this sharp or no?
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
And can you wiggle your toes here? Okay, good. And now can you curl your toes around my finger? Perfect. And release. Good. And curl your toes around my finger. finger. Perfect. Release. Good. Okay. Now I have here a hot and a cold object. I'm going to touch you with one at a time. Go ahead and say hot or cold.
Hot.
Good.
Cold.
Good.
Hot.
Good.
Cold.
Good.
Cold. Hot.
Good.
Cold. Cold. Hot.
Okay, a little bit of mixing of sensations of hot and cold. So from a neurological point of view, we need to keep an eye on the dermatomes in your calves and plantar region. Okay, you feel this?
Yes.
Now I want you to tell me when you stop feeling this.
No. No. No.
Okay, good. Let's try that one more time.
No.
Good.
No.
Good. Was that sensation continuous?
Yes. No.
Good.
No.
Good. Good neurological reflex here. Okay, you can go ahead and stand up so we can discuss the findings. Okay, folks, so this completes the assessment for today. I did a very thorough neurological assessment of the dermatomes in your upper body, your face, your lower limbs as well, and your arms. There was a little bit of a mixing of hot and cold sensation on the back of your legs as well as on the plantar region of your feet. So I want us to monitor that symptom. The knees were physiologically okay. I'm not seeing anything that we need to further follow up on, but I also want to monitor the sensation that you mentioned you're feeling in your right knee. So I'd like to see you back in about a month and reassess.
Okay.
Do you have any questions for me today? Okay, then I'll see you again soon.
Okay. Thank you.